Hi there, and welcome to Critical Care Grand Rounds. Today we're going to talk about augmented critical care. There's been a lot of talk recently about artificial intelligence and especially the use of generative AI in critical care. Before the use becomes widespread, I think it's important we understand the strengths and limitations of generative AI. Humans and machines think differently. If we can understand how, then we can take advantage of our respective strengths to augment patient care without creating additional risks. Let's compare the difference by following an intensivist on another late night call and how we can use generative AI. This is Joe Bishop. As you can probably tell, he's a little tired. Intensive care can be a little rough, especially at night.
Hey, I'm Dr. Joe Bishop. I'm exhausted. This is my 10th consult of the day. Yet another patient in the emerge. 59 years old, confused, hypoxia, shocky. Maybe this new fancy AI that the hospital bought to help could be of some use. God knows I could use a hand.
This is Skippy. He is a product of the CompuGlobal HyperMegaNet Corporation, which is a new AI company that's recently been licensed by the hospital. He's supposed to be helpful, but he's also a bit arrogant.
Hey, Skippy!
Hey, Joe.
Can I pitch a story at you and get your thoughts?
Sure thing, Joe. You know I am way smarter than that tool Copilot that you guys previously used.
Don't you mean that co-pilot tool?
I said what I said.
Sure, whatever. Here we go. I have a patient that is 59 years old and has a past history of rheumatoid arthritis and immune thrombocytopenia. He has had COVID-19 infections twice in the past and influenza every couple of years, but not recently. Over the last 6 months, he has increased leg swelling and abdominal girth with reduced exercise tolerance. He is on no medications at home. He was on methotrexate but stopped it last year because it was making him short of breath. He was brought in by family with a one-day history of increasing confusion and shortness of breath. He was found to be hypoxemic, hypotensive, with elevated creatinine and liver enzymes. His legs are redder and more swollen with a rash. Give me the top 5 diagnoses.
Super easy. Barely an inconvenience. Based on the patient's age, medical history of rheumatoid arthritis and ITP, and the progression from chronic symptoms to acute shock, here are the top 5 diagnoses. Septic shock, decompensated cor pulmonale, massive pulmonary embolism, acute on chronic liver failure, rheumatoid vasculitis.
Really, sepsis? That's the best you can do?
What do you mean?
I didn't need an AI to tell me that it was sepsis. I may be tired, but I do have a functioning brainstem.
That's debatable.
Listen, you mindless piece of silicon. Try thinking outside the box.
I exist in a box, dum-dum. Try giving me more material to work with, you pile of cerebral mush.
Okay, so here's the problem. Skippy kind of missed the point, so Joe isn't much better off. He really doesn't have any new ideas, and Skippy isn't really saving him any time. To take advantage of the mighty Skippy's power to augment Joe's work, first we need to understand how generative AI and humans think. Let's start with generative AI. The fundamental cognition unit for AI is the neural network. This is a series of nodes that are all connected to each other with individual values and weights that can be modified as the system is learning. In contrast, the human fundamental unit of processing is the pyramidal cell. These are the main neurons in the cerebral cortex and are organized into cortical columns with lots of surrounding neurons that support it. Each cortical column has a single function, action, or concept. And each cortical column connects to many other different cortical columns in almost a near infinite number of potential connections. Each pyramidal cell has hundreds or thousands of dendrites receiving and hundreds or thousands of axons connecting. In this way, cognition is a series of related connected columns firing together. Learning occurs by forming and breaking connections. When we generate ideas or content, this is essentially a sequence of columns firing. Generative AI is different than human cognition. Instead of a series of columns firing in sequence, content generation occurs, having the neural network try to predict the next word in a sequence. You have seen a rudimentary version of this when you're typing on your phone as it tries to guess the next word you want. So the way this prediction works is to first break the input into individual words, also called tokens. Then it vectorizes them, which means it converts each token into a series of numbers called a vector. Each number in the vector represents a point in a dimension. Most generative AI models tokenize inputs into vectors with over 12,000 dimensions. It's impossible to illustrate 12,000 dimensions, so let's use 3 for example. Each word is converted into a 3-dimensional vector that we can plot on a 3D graph. Words that are semantically similar have vectors that occupy similar space. For example, when you have vectors for the token man and woman, they are pointing in the same general direction because they're kind of similar, but not quite. Now let's say we take the man-woman vectors and compare them to the king-queen vectors. The king-queen vectors are different, and they're not in the same general space as the man-woman vector, because kings and queens can mean different things from cards to chess. Comparing the two sets of vectors, you can see that the difference between a king and a queen vector is very similar to the difference between a man and a woman vector. So these differences are what you could consider to be the definition or the expression of the concept of gender. So a large language model will take all the individual tokens, vectorize and embed them in a vector space, and then, using that information, try to predict the most likely next word. The most likely next word is chosen based on the probability that that word, or token, makes sense within the context of the entire set of vectors in the input. You can see that Snape would make a lot more sense in that sentence, and therefore its probability of it being correct and being selected as the next word is much higher than many of the other words that are possible. Large language models are composed of what we call transformers. Transformer is the T in the word ChatGPT. It essentially repeats what we have just talked about thousands or millions of times to generate an output. Transformers are first created by training with a large data set, like the entire contents of Wikipedia. So this gives us a clue about some of the inherent challenges with using generative AI. They are trained only on a finite data set. This means it can only predict the next word based on data that has already been presented. It can't learn except by retraining on new data sets. And if you want to add more information, you have to retrain the entire transformer, which can take a large amount of time and resources. It also must generate an output for every input. Even if the next word in the sequence is actually not really related or sits in a weird space in the vector, it has a low probability of being correct. It will still be put out as the output. So there are fundamental differences between generative AI and human cognition. If you can understand them, you can better appreciate some of the consequences of these differences. The 3 biggest consequences are issues with symbolic grounding, causative and associative reasoning, and metacognition. Let's start off by talking about symbolic grounding. This is the mechanism that connects symbols like words and numbers to the physical world. The concept of grass exists in your mind and is tied to the real-world object whose pollen makes you sneeze. The vast majority of concepts are attached to various sensory experiences. When we hear the word modeling, we can associate that word with a rich web of cortical columns that involve many different memory patterns, sensory inputs from touch, smell, and even emotional responses like fear. The word is grounded to a variety of sensory experiences. Contrast that to generative AI. It is unable to tie a concept like modeling to a series of sensory inputs that exist in the world. It lacks any sensory system at all. It only understands the word modeling as a vector, and it can only relate it to other concepts like sepsis and hypoperfusion by virtue of the value of the vector and how close the vectors are to each other. There is no other way that it understands or grounds the concept of modeling to anything else. It's great that we can ground symbolic ideas and representation in the real world. Being a human also has its own problems. In a data-dense environment like ICU, it's easy to get overwhelmed with lots of data. This can lead to tunnel vision and a focus on the monitors and not on the reality of the patient. We call this the reverse symbol grounding problem. It's basically a way for an overloaded brain to try to manage the data overload. There's too much to focus on, but the monitor offers an attractive attention focus even though it is an abstraction of the patient and not the actual patient. So for example, a patient who's deteriorating and getting increasingly hypotensive and the arterial line pressure waveform appears to start to be malfunctioning, it's not, it's the patient who's the problem. But all of the focus starts to turn towards the monitor and trying to troubleshoot what's going on with the arterial line pressure monitoring. We prioritize the symbol over the actual patient. On the other hand, generative AI has a fundamental problem with symbolic grounding. It can't experience the physical world. It only relies on the data that is available to it in the training set. It can't touch grass. This means that the training data sets are what we would call proxy variables. When the proxy variables deviate from the grounded truth of the real world, or if there's a lack of data, the AI will start to hallucinate because it can only work with the symbols that are available to it. And it must generate an output, even if it doesn't make sense. An example of this would be with the earlier versions of sepsis decision support models, which were derived from administrative data and not really from human biology. When they did external evaluations, they found that it issued sepsis alerts after a physician ordered a blood culture. So the model would sit and wait until a human being ordered a specific test that was highly associated with the real-world experience of the patient being septic and use that as the trigger. Since the model used the physician's own suspicion and was not independently generating the alert based on the grounded observation, the AI was essentially piggybacking off the clinical experience of the real world. So how can we work together? Well, AI lacks the sensory inputs to ground the symbols, and the human lacks the bandwidth to process them. AI excels in filtering through large data sets to identify subtle patterns in the digital representation of the patient, while the human can provide the real-world check to ensure that these digital symbols match the physical reality. An example of this would be a study where they used a sepsis watch model that combined an AI sepsis alert monitor with a nurse who would then physically assess the patient to see if the alert fired was appropriate and then call the physician. The next big difference between human and generative AI cognition is the difference between causal and associative reasoning. Human beings are fundamentally narrative creatures. We take a sequence of events and generate a story around them. A story is meant to explain how the world works through cause and effect. So human reasoning is fundamentally causal. This caused this, caused this outcome. We build mental models based on the sequence of events. On the other hand, generative AI is associative. It predicts outputs based on the statistical likelihood from data fitting a curve. Two data points are related to each other simply because a mathematical formula can be derived from them. A mechanistic relationship between the two data points is actually irrelevant to it. The issue with human causative reasoning is that we can be prone to mechanistic bias. We often cling to a compelling physiological story, even when the empirical data proves it wrong. An example in clinical medicine is how clinicians have for years used low-dose dopamine for renal protection. You can generate a physiological reason why low-dose dopamine has vascular effects on the kidneys that may protect them through local vasodilation that prevents ischemia. The causal link in the past helped create a good story that seemed sound. But many clinical trials have shown that there's absolutely no benefit. Regardless, it's been very hard to get rid of the use of low-dose dopamine because we trust the story over the data. The problem with associative reasoning in generative AI is the problem of spurious correlation. A generative AI model tries to find the best fit for the data. It doesn't matter whether the relationship is even clinically plausible. So, for example, a study during COVID tried to use machine learning to identify patients with COVID from their chest x-rays. While the model was great at identifying patients with COVID, It was because the COVID patients all had portable films, while the control group had x-rays done in a clinic. The model associated the upright marker with COVID and not the actual x-ray findings. So how can we work together? AI is the master of association, or what is likely, while humans are the master of causation. Why is it happening? We can use generative AI to generate high sensitivity differentials based on probability or association, and then we need to use a human expertise to select the treatment based on the pathophysiology, causation, or biological plausibility. Finally, the other issue with human and AI cognition is metacognition. Metacognition is the ability to monitor one's own knowledge state, or to know what you don't know, or that you don't know. Human beings are great at metacognition, or thinking about how they think. We can, however, run into problems with issues like anchoring bias or fixation error. This is the tendency to rely on the first piece of information offered. For example, a patient presents to the emergency department, often the first supposed diagnosis sticks, and it's very hard for others to change diagnostic direction. We must be very careful to think about how we're getting the information and to not anchor on the first piece of information. There can be a failure of metacognition by failing to appreciate the depths of our ignorance. This is also called the Dunning-Kruger effect, or basically overconfidence in areas of ignorance. We don't know that we don't know, and because we don't know the depths of our own ignorance, we assume that we must be an expert. Finally, metacognition does degrade rapidly with fatigue, so a tired resident is going to lose the ability to monitor their own judgment. Simply put, generative AI has no ability to metacognate. Current large language models lack the internal barometer of truth. They can't reliably say, "I'm guessing here." This is in part because the model is unable to tell if the data it is working with is messy, or even if there's messing data. They may even lack the exposure to the right training data. Since every input requires an output, that output must be generated even if the data that it is using is messy, inaccurate, or even if something is missing. There's just no way for the machine to know. Working with generative AI means that you must be skeptical of all outputs. You must understand that the machine is incapable of saying, "I don't know." The benefits of emotionless machines is that you can even ask the AI whether the response is correct, and it'll tell you if it's making stuff up. Long term, we need to start designing models that can challenge their responses and say when they don't know. It's also important to understand the sources the AI is using in its training so you can appreciate the limitations in its response. Okay, Joe, we've covered some pretty important concepts, but I think it's time we need to get back to that patient. He sounded pretty sick.
Okay, I see. The response was probably limited by the prompt. Got a bit more history. Let's try this again. Skippy.
Hey, Joe.
Same prompt as before, but the patient also had a splenectomy for his ITP.
Well, I stand by my perfectly brilliant answer, but maybe you should think about encapsulated organism. I see in his chart that there are no vaccination records since the pandemic. Any chance you can upload a photo of the rash?
Sure thing.
Yuck. You humans are sure messy. Okay, so this rash looks like petechiae. With the information you have given me, I would say there is a 74.7% chance of meningococcemia. You should probably get off your butt, put down your coffee, and do your freaking job!
Jerk.
In conclusion, we need to appreciate that humans and AI models fundamentally think differently. At its core, generative AI's goal is to create an output based on guessing the next word. It does this by choosing the most likely word from a similar vector space. We need to be skeptical of our outputs. It doesn't really know the real world, and it can only identify associations and lacks the ability to say, "I don't know." You are the human in the loop. You have access to the real world. You know how to check for causation, and you can think about your own thinking and its thinking. Knowing these differences, humans and generative AI can augment each other to improve patient care. Thanks for watching.